Hello, everybody. Here is Tatiana Bazzichelli, the co-director of the Disruption Network Club. I'm very happy to introduce the second panel of today, that is actually our keynote. This is the conference Behind the Mask, Whistleblowing During the Pandemic. And we are inviting experts that have been speaking out to save people's life by denouncing abuses and wrongdoing in the course of the COVID-19 crisis and beyond. The title of the keynote of this evening is Whistleblowing and COVID-19, Telling the Truth at the Center of Crisis. I'm very happy to welcome here Erika Cheung, the co-founder and the executive director of Ethics in Entrepreneurship, and also Eileen Chubb, that is the co-founder of the Whistle and also of Compassion in Care. The panel is moderated by Delphine Halgand, that I really want to welcome here with us today. She is an expert on press freedom and regulatory frameworks for platforms. She was the lead rapporteur from the Forum of Information and Democracy's report on Infodemics. And she's also the executive director of the Signal Network, that is a very important non-profit organization that support whistleblowers. They do a very important work that Delphine is also going to tell more tomorrow when she will be in the next panel. At the same time, she was also previously the Reporters Without Borders North American director. So Delphine, thank you so much for being with us, and I leave to you the honor to introduce our great speakers and the panel of today. I will come back then for the questions from the chat. So I also want to remind our audience that is following us online that we have an active chat. They could send their message there, they could interact with us. And also through this chat, I will be able to ask the questions to the speakers at the very end after the moderation of Delphine. So just go on our website, disruptionlab.org, if you are following through other channel, and you will find the chat there. So Delphine, I leave the word to you, and welcome everybody at the Disruption Network Club conference.
Thank you so much, Tatiana, for putting this fascinating discussion together and for inviting me to moderate the keynote conversation, Whistleblowing and COVID-19, Telling the Truth at the Center of Crisis. And thank you to all the talented team of Disruption Network Lab to make it happen. But thank you all for being here today for this conversation. So as Tatiana said, my name is Delphine Halgand, and I'm the executive director of the Signals Network. And I founded the Signals Network only 3 years ago to really enable whistleblowers and international media investigation to work together to hold powerful interests accountable. We are now operational in 11 countries in the US and 10 European countries, where we support 24 of whistleblowers who have provided information to media related to the biggest story of our time, from corruption to Me Too to political propaganda online and COVID-19. They provided information to media like the New York Times, The Guardian, BBC, Der Spiegel, and so on. And basically, journalists and general counsel of media send us their source. And then the whistleblowers who shared information with them, they need legal advice, they need a trusted lawyer, and that's what we do. So I can go on and tell you about the recent investigation we published on blood donation or Huawei, but really today we're here to discuss whistleblowing and the COVID-19 crisis. And first, I would like to start by reminding the definition of whistleblowers, because I think there are many definitions and it could mean different things for different people. And actually, even the definition itself evolved over time. And I like to precise what we are talking about, or at least what I'm talking about. I'm talking of whistleblowers. And so my favorite definition is the one of the Council of Europe, which I think is the most inclusive. So I will read it to you. the term whistleblower must be broadly defined so as to cover any individual or legal entity that reveals or reports in good faith a crime or lesser offense, a breach of the law, or a threat or a harm to the public interest of which they have become aware either directly or indirectly. I actually sincerely think that the COVID-19 crisis made it more obvious than ever before why we need whistleblowers and why we need to protect them everywhere. And the COVID crisis made first, I think, more obvious than ever before how the lack of freedom of information, how the lack of protection of whistleblowers everywhere, and actually in China, impacts directly on the lives of all citizens across the world. So to repeat, it's how actually the lack of whistleblower protection in China impacted us all. And I think the coronavirus outbreak has taught us this lesson the hard way. So, I'm not here to blame China, no, I'm here to blame the lack of whistleblower protection. So basically, as you remember, in December 2019, a Chinese doctor in Wuhan, Dr. Li, posted a message on the messaging app WeChat about a cluster of cases of flu-like disease that had been treated at his hospital. And he was worried by it. 7 patients were in quarantine and the symptoms reminding him of SARS. So Dr. Li urged colleagues to wear protective gear. Within hours, screenshot of his messages had gone viral. He was then targeted by the Chinese police for spreading rumors, as authorities tried to control the spread of information about the outbreak. Dr. Li was just trying to blow the whistle on the virus early. He was trying to save lives. He died of the virus on February 6, 2020. So it is difficult to quantify the impact of the Chinese censorship. How many people really died in China of the COVID-19? How many lives in China and abroad could have been saved if the Chinese authorities didn't try to control the narrative early on? We don't know. But what we know is that China has not been alone in trying to control news about the virus. That China has not been alone retaliating against whistleblowers for raising alarms and sharing information the public needs to know. There are many examples all over the world. The US Navy fired the captain of a ship days after he requested for help, and that was published in a newspaper. A Florida public health whistleblower, Rebecca Jones, was fired because she refused to manipulate the state COVID-19 statistics. A countless number of coronavirus whistleblowers in Europe and everywhere in the world have exposed countless health hazards, health policy failures, market abuses, privacy concerns, and more. And we should, and I think here today we are grateful to all of them for taking the risk to share information of public concern. We need to protect them now more than ever. If the truth, we cannot end this pandemic. Health workers, scientists, politicians, business owners, school teachers, mothers, parents, everybody need to know how the pandemic evolves to act appropriately. We need to know about the reliability of tests, treatments, vaccine, and safety protocols across the world to be able to recover normality as soon as possible. We should all call on our public authorities to protect those who expose harm. This is our duty to freedom of information, transparency, accountability, and whistle protection are not stifled in the name of fighting against the virus. Otherwise, we would not have learned the lessons. Today, we have with us 2 inspiring women and whistleblowers, Erika Cheung and Eileen Chubb. And I'm really grateful for you ladies to be here with us. Thank you. I will actually start with Eileen. You were a care worker in a care home in India. You were forced to quit after being abused of elderly resident in 1999. And from there, you started a campaigning to break the chain of elderly abuses, complacency, and to support whistleblowers. So thank you for being with us today. Thank you for all you do every day for many, many years. Please take us on your journey from being a whistleblower to supporting healthcare whistleblowers. And I look forward to hear the main lessons you want to share with us in today's COVID-19 context. Thank you, Hélène. The floor is yours.
Thank you so much.
Thank you so much.
Where do you start? We do get whistleblowers from all sectors. Compassion and Care deals with healthcare, and I'm going to use that topic tonight. But we also have teachers, drivers, train drivers, a whole raft of different whistleblowers. COVID was an unprecedented event, and we had to adapt very quickly as events unfolded. The Compassion and Care helpline had a 60% increase in calls, and we saw the disaster unfold hour by hour, working late into the night to support staff who were all working shifts. Often whistleblowers will need the most support when they step back, when they come off duty. Despite running a helpline for 2 decades, we'd never encountered anything like this. We were working 14 hours a day, and I'm not ashamed to admit that I cried my heart out most days, and the emotional toll of call after call from traumatised whistleblowers, bearing witness to what can only be described as human rights violations. The suffering, fear and avoidable death could defeat the best of us, but for one single thing: in the middle of the devastation, the courage of whistleblowers. We were quickly identifying themes from the helpline data and publishing regular reports. Some of these themes were foreseeable, some were simply staggering, but all were a tragedy. People in all care settings were singled out as expendable for the greater good, and the foreseeable fatal consequences of government policy on hospital discharge of COVID patients into care homes became apparent. We bombarded the government with our evidence and did everything in our power to highlight the unfolding events. Any pretense that whistleblowers can safely report abuse has been stripped away by COVID. One of the issues we have been aware of long before COVID was the complete lack of investigation of whistleblowers' concerns. 90% of all our pre-COVID helpline calls contacted us after taking their concerns to all the statutory regulators and safeguarding, and they were all failed by those authorities. This charity is not very popular with such authorities for exposing the unpalatable truth. COVID concentrated these failures as never before. For example, during COVID, the healthcare regulator, CQC, recorded over 2,600 calls from whistleblowers. They resulted in just 17 inspections. The rest of these concerns were dealt with by a phone call to the care home, asking if they were guilty and taking the response at face value. This is what demoralises whistleblowers. This is the mountain that has to be climbed. We have recently called for evidence on all regulators, safeguarding and all other authorities who fail to act on concerns. Concerns that are often reported at great risk to the whistleblower. We have extended this due to the sheer volume of evidence coming in. We are still waiting for FOIs we submitted last June. One FOI was supplied, however. We asked for a breakdown of nursing and residential care homes deaths, as this information was not being published. During the first wave of COVID alone, 6,000 people died in residential care homes without any medical intervention at all. Staff were telling us that people with COVID could not take fluids and were dying from thirst, that people were gasping for air for days, but there was no oxygen available in non-medical establishments, that people could not swallow their prescribed medication and were dying from complications, that people had no pain relief, that there were so many patients in ordinary divan beds which had no pressure relief, that people sick with COVID could not be turned and had developed pressure sores and had died in agony. Other themes that emerged early on: up to 70% of people in care will be living with dementia. The government policy of discharging COVID patients into care homes made no allowance for that fact, that people with dementia wander. Staff were telling us that some residents were locked in their bedrooms to stop them wandering. These people could be heard calling out distressed and frightened for hours at a time. Some people were drugged with antipsychotics to stop them moving, resulting in permanent loss of mobility and drug-induced Parkinson's and other harm. Other homes let people wander, and COVID spread like wildfire. Other themes we reported on: people who were really sick not being sent to hospital, lack of PPE for various reasons, not all of them acceptable, staff told to socially distance while carrying out care, staff not informed of residents who tested positive for COVID, staff with suspected COVID told to work, staff sacked or forced for raising concerns, lack of staff and resulting neglect. The following figures are from our COVID 8th report, which was very early on, but we did a sort of spot check on how many whistleblowers were suffering detriments. 6 staff at that point had been sacked for reasons that included alleged breach of confidentiality or excessive sick leave. 37 staff had been working in hostile conditions since whistleblowing and felt forced to leave. 17 staff were on 0-hour contracts and had not been given further shifts since whistleblowing. 39 staff are intending to leave their employment in the near future, of which 21 intend not to work in care again. 99 staff out of a total of 246 have already or will be in the near future lose their job as a direct result of raising concerns. We do expect these numbers to rise in the coming weeks due to a further 76 staff experience some form of harassment or adverse treatment as a result of whistleblowing. From an overall total of 246 cases, 175 have reported harassment and/or adverse treatment since whistleblowing. I have observed that from the overall numbers, that those whistleblowers who've raised concerns that could be attributed to being beyond the provider's control, for example, an inability to obtain PPE due to genuine financial hardship or shortages of supplies, are less likely to suffer detriment, whilst those whistleblowers who are raising indefensible issues are more likely to suffer detriment. Some see a whistleblower and see an opportunity to make money from a legal case. We know that a whistleblower is the voice of those who are suffering, those at risk of harm, the voice of the public interest. There's not enough time to include all the voices from the front line, but I think at the heart of what we do is we try to make sure that whistleblowers are heard, because I've been there and there was nowhere for us to turn to. The following extracts are what happened to whistleblowers in their own words, anonymised. Extract 1. There are not enough staff. Lots of people are sick, and sometimes we have agency cover, but mainly we don't. I reported how people were not being cared for. There's not enough of us. No one could cope with this. The people we care for can't do anything, like pick up a drink. We have to do it, and we can't get to everyone. One person has not had a drink all day, not since 7 this morning. Lots more like that. Every day, people calling, help me, help me. I hate myself for having to walk past them. I hate this company for making me do this. I hate them most for not listening to us. I love the people I care for, but I've had my shifts cut and I'm on a 0 hours contract. They call it bank staff. I had no choice but to say what was wrong, but I will always feel guilty about that because it meant I had to leave the people I love. Extract 2. After telling them about the things that were so wrong, I feel vulnerable. I can't explain it, but things have changed. How management speak to me now, it's different. They are on guard. I won't leave the people, but as soon as this whole thing is over, I am out of here and I will never work in another care job, not after this nightmare. Extract 3. We really did everything to keep people safe in here. Then they told us someone with COVID-19 was coming in here. They said we should barrier nurse them. What? With no nurses and a pair of rubber gloves. I would like to see effing Matt Hancock, the health minister, come in here and do it. Yes, I blew the whistle and said it was not right for the person coming in, not right for the people living here. All the staff feel the same, but the fear of saying anything, they know it will cost them their job. It cost me mine. I blew the whistle I blew the whistle about the PPE. What happens? They got some. I went on shift yesterday and saw staff taking used PPE out of the dustbins. The manager told them to spray it with disinfectant and use it again. There's a cupboard full of PPE down the hall, locked, just for anyone to be shown. Like the bloody CQC, just for show. I give up. Extract 5. We have PPE now and we're supposed to be grateful for that. We waited ages. People were sick. Staff got sick, and all because no one would listen. Lots of times in the last week I've come on shift and found residents on wash still in bed. That would never have happened before. And it goes along. There's hundreds and hundreds of testimonies that we've gathered, and the horror, I think, of it is that those people have got nowhere to go to report these concerns. They're going through the normal channels. They go through their employer, they go through to the local authority, they go through to the regulator, but no action is taken. And then all the other staff see that whistleblower has lost their job, and the next time there'll be silence. And that is the legacy of what's happening. I think a lot of the staff, were trying to justify that they were right because they start to doubt themselves that what they're reporting is why can't people see that it's serious? But of course they can see it's serious, and the worse the harm that's been done, the more that whistleblower is targeted. So you've got people going to work for an 8-hour shift that there is no one speaking to them. They're working in absolute silence. And that I know from my own experience, walking through a wall of hate every day to go into the job you love, it breaks you a little more every hour of every day. And by the time that most whistleblowers are not sacked. It's not usually nice and neat. They're usually forced to leave. They're not given any choice in the matter. And I think that's the thing that is so sad, is that this has gone on in the UK for 2 decades since the first case, which was my own case in the current whistleblowing law. And there are so many people that see whistleblowers as something to be exploited, and that I think should shame us all, because they're not a legal case. They don't want to have to go to court. They just want the protection for the people they care about when it matters. And that's why we campaign for Edna's Law, because they would have 1 hour to act on receiving a concern. The employer would have 1 hour to act. And the fact is, there's a clear paper trail, and without a clear paper trail, you end up with a situation where the whistleblower and the employer, it's one word against another. And the way the whole system operates, I think we have regulators as well. There's a major problem with regulators. I think, to be honest, we spend billions on regulators across the board, and they're not doing their job. They have no investigation skills, and they have even less common sense. And I think that's one of the massive themes. So what we're seeing with COVID was the tragedy that, was flagged up for years in advance, that this, only took something like this to bring all of this out. And still the government are ignoring, and still we're waiting for a response since last June. And we just send reminders every month, and we bombard. But the fact is, we know what's happened is totally wrong, and there's no excuse for it. And we will fight, and we will keep exposing the government until they're held to account, because what happened is unforgivable. Thank you.
Thank you so much, Eileen, for sharing all this with us. It is heartbreaking, and I do not use that word often, but really hearing from you and this extract is heartbreaking and resonates with a lot of other things. But to think of these elderly residents is heartbreaking. But I look forward to go back to you to better understand how you do help the whistleblowers who come to you. I want to hear more about how you consider whistleblowers being exploded in these legal crazy circumstances, and how to change the regulator. So I have a lot of questions for you, but first I definitely want to turn to Erika, which is really another inspiring woman and whistleblower. So thank you, Erika, for being with us today. So Erika, to put it bluntly, you hold a $9 billion company accountable, Theranos. So that's quite a crazy story. And so for those who have not read the amazing book Bad Blood, written by the Wall Street Journal reporter John Carreyrou, or for those who have not seen the HBO documentary The Inventor, or for those who do not know Erika yet, please, Erika, take us on your journey, explain us your whistleblower journey, and share with us some of your thoughts on how a speak-up culture could a stronger speak-up culture could help protect whistleblowers. Thank you, Erika.
Yeah, thank you so much, Delphine, for that introduction, and Disruption Labs for having me here today. This is pretty exciting to see so many people who are engaged and interested in what can we do to facilitate stronger protections for whistleblowers and foster better cultures to help people who are speaking up. So I think something that's interesting about my case is I was involved in whistleblowing in a blood diagnostic company that in this context of COVID would have actually been fairly useful. So essentially what they were trying to create at Theranos was a medical device where you would be able to take a finger stick of blood and be able to run your diagnostics. So in the COVID crisis, what did we see? It was very hard to get COVID-19 testing onboarded very quickly because it was done by centralized laboratories and there were a lot of inefficiencies. So even this case study was a clear usage of what was at the time, back in like 2013, a sort of Silicon Valley startup darling. And I wanted to show you guys a picture, and I think Theranos is a very visual sort of case and company of the founder of this organization. So as I said, this was one of the hottest companies in the Silicon Valley. It had raised $700 million at about a $9 billion valuation. And at the time, before the kind of truth was revealed about what was going on behind closed doors, she was really celebrated as this incredible founder who was going to revolutionize the way in which we did blood diagnostics. So I kind of wanted to give you guys the delta of how do you go from this, of being on the covers of magazines and sort of, posed in these great marketing campaigns that has, a lot of the world sort of excited for what you're going to produce, and to the sort of next slide of things of ending up on the cover of major magazines saying that you were a $9 billion scandal. So what was that kind of delta? So I wanted to give you guys an idea of what this looked like. So what was the technology that Theranos was working on? So as I mentioned before, on the next slide, you'll be able to see the sort of comparison. So typically with traditional diagnostics, you have these big, large, bulky machines that can run, a subset of 40 tests. And Theranos was trying to create these small box, printer-sized diagnostic kits that would be able to run the full breadth of blood tests that you could imagine. So it was this exciting technology. It was this new innovation that was supposed to be cutting edge. And for whatever reason, people really believed that Elizabeth had found the secret sauce to sort of integrate all these new technologies to create this sort of magical box that would run all these blood tests. So in addition to this compelling technology, she had brought in some of the most high profile people to kind of back her. And so we'll see some of these characters in the next picture. And I think it's important to understand that, you know, when it comes to healthcare and when it comes to these really success cases, there's a lot of power players involved. There's a lot of really powerful decision makers who have a lot of influence in determining, you know, whether something succeeds or it doesn't. And so Theranos had brought people on their board of directors like Henry Kissinger, George Shultz, and James Mattis. These are all sort of high-profile figures in American politicians. In her investor pool, she had people like Larry Ellison, the Walton family of Walmart, and Betsy DeVos. So she had amalgamated just this really impressive community of people to back her technology. And in addition to that, of these things, she had one of the strongest partnerships that you could ever imagine, at least in the United States. So on the next slide, we'll see the ceremony of Theranos breaking a partnership with Walgreens, which in the US, the slogan is there's a Walgreens on every corner, because there is pretty much a Walgreens on every corner. And so Theranos was going to open their blood testing, you know, facilities in Walgreens all across the United States. So they had good tech, good backers, lots of investment, and one of the largest business partnerships that you could imagine, which was with Walgreens. So what kind of happened here? You know, a company that seemed to have it all, had a compelling story, had so many people that were excited about it. What was kind of going wrong? So this is sort of where I come in, and I'm going to give you guys just a snapshot for the sake of time of what were the types of problems that I was seeing while I was working for the company, and which further then led me to blow the whistle. So on the next slide, this is an example of when you are running blood diagnostics, you run these things called quality controls. So a quality control in this case is a known concentration of a blood sample. So here I have vitamin D. I know it's 20 micrograms per mil, but when I'd run it in the Theranos device, I'd run it once, it'd come out 150. I'd run it again, it'd come out 2 micrograms per mil. I'd run it again, it'd come out 35. And so every time I would run a quality control sample where I know the concentration, I'm supposed to get the right answer, I was seeing all sorts of variability. And this wasn't just for vitamin D, but it was across so many different types of test. So this could be for hepatitis. This could be for thyroid panels. And this was really scary. This was extremely scary, because if I have the case that I'm failing testing my quality controls, imagine if I test on a patient and I have so many failures that are accumulating, and I'm seeing with quality controls, I'm getting like a 65% failure rate. That means that if you were a patient and you flipped a coin, you had a better idea of, say it was COVID, of determining, you know, flip a coin, you would probably strike a better percentage of saying whether you were negative or positive. So that's the extent of what the problems were. And initially I had gone internal to sort of what I didn't refer to at the time, but blow the whistle of really trying to reason with people who worked internally within the organization to tell them that we were having problems and to the extent of those problems. And so I went to, on the next slide, you'll see the different players that I had reported to. So I reported to the people who worked in the laboratory. I had reported to the COO of the company, and I had reported to George Shultz, who was one of the board members, and essentially got a lot of the same responses of, at the time when I did this, I was about 22, 23 years old. This was my first job out of college. You're young, you don't understand anything about statistics. You need to do the job I pay you to do and process patient samples at all cost. I brought in a lot of really smart people and they say it works, so I'm going to trust them. So this is kind of some of the pushback that I was getting internally. But at the end of the day, the only thing I could anchor on, regardless of all this chatter and all this chaos and this sort of feeling of alienation, was the fact that at the end of the day, when we made a mistake on a patient sample, it was not told to them that we had technology that didn't seem to be working well. And that was not okay. And for me, the big driver and the big anchor was, how do I get people to realize, with the insider knowledge that I have, that this kind of behavior needs to stop, and it needs to stop before more patients become vulnerable to the actions of this company. So this is when I kind of turned externally. Some of my whistleblowing, and on the next slide, we can see the sort of mechanism of external whistleblowing. Some of my story was based on luck, and some of it was based on having appropriate channels to be able to report to. So I had initially gotten contacted by a Wall Street Journal reporter who opened my eyes to the fact that he would be able to write an investigative piece to sort of expose the truth of what was going on. But before his piece came to the public eye, essentially Theranos, the company, went on this huge witch hunt. So they threatened to sue me with one of the top corporate lawyers in the US, David Boies. They hired private investigators to follow me and intimidate me. They did a lot of things to try and make me really uncomfortable with saying anything and speaking up. But luckily, all of that led me to talk to a lawyer, where I was able to see that there was a reporting mechanism. I could report to a regulator in the US. This happens to be the Center of Medicaid and Medical Services, that could stop them, conduct an investigation first and foremost, and see if there were deficiencies in the lab. They would stop processing patient samples. And luckily, I did this because my intuition about some of the the evidence that I compiled of the experiments showed, and you'll see in the next slide, that there were massive deficiencies across tons of different assays, and Theranos had to revoke tens of thousands of patient samples. So I think, I don't want to get too reductive, but for the sake of time, a lot of people will claim, oh, Theranos didn't succeed because it was a product failure. But honestly, they could have bought companies. They had so much money. What I really argue is that it was an ethical collapse. And there's this great book by Marianne Jennings called The 7 Signs of Ethical Collapse. And when I read this, I was shocked, because Theranos kind of hit the mark of every warning sign and red flag of a company that's about to have a ethical collapse. And I think too, I want to anchor on today for the discussions that we're having in terms of whistleblowing, and also in terms of what that means in a healthcare crisis specifically, is fear and silence, and this idea and notion of goodness in areas to atone for evil in others. And I think something about healthcare specifically, because it is such a benevolent act, it gives people the moral licensing to get away with doing a bunch of egregious things, because at the end of the day, I'm doing the best I can to sort of help people. And this is something we have to be cognizant of. So I think another interesting thing about healthcare, and kind of in the support of what Eileen's story was, is 10% of healthcare workers only 10% of healthcare workers really report something when they see something wrong, which is weird when you think about it, because when it comes to matters of life and death, you would expect everyone, there's almost universal agreement that people would speak up and they would say something, but it's not something that you genuinely see. So I wanted to give you guys a few food for thought points of, why do people whistleblow, and why do people decide to not speak up? So in terms of people who whistleblow, one of the sort of social psychology underpinnings of why people whistleblow is because it is a extreme pro-group behavior. And whistleblowers tend to fuse their identity to the things that they are doing. So they emphasize so much responsibility into what they are doing, that they feel that if they don't do something about the bad behavior that they're seeing, that this will ultimately affect the greater good of the whole of the organization. But on the contrast of, why do people remain bystanders and why people sort of come forward? And really, it's because of the opposite problem, where people will diffuse responsibility amongst everyone else. They'll see an action and kind of make the assumption that someone else is kind of taking care of it. So I think, what I'll sort of leave you all with is this idea: how do we restructure the balance of responsibility so it doesn't have all the pressure on one person to whistleblow, but also not have everyone also think everyone else is taking care of it? So on the next slide, when we think about, and Eileen did a wonderful example of giving us very pointed conversations of why it's hard to speak up and why people tend to feel very alienated after they do it. If they report, nothing's done about it. If they do, they'll fear retaliation, the fact that they lose their jobs or that they won't be able to continue, doing the things that in most cases they love to do. And then also the social rejection of the fact that you're not being a team player or you're being adversarial or something else of that nature. So I think, amongst a crisis, I think something to anchor on and the importance of whistleblowers and what we've seen is there's this great quote by this poet who it says, mistakes are a fact of life, but it's the response to those errors that count. And I think when we think of whistleblowers, we need to understand them as sort of the corrective force to just the normal human condition of making mistakes, and to sort of building a pathway to build better outcomes for everyone involved. So I'm very excited to join back with Delphine and Eileen in a conversation about what we can do in order to make sure people in this scenario are supported. So thank you.
Thank you so much, Erika. This is inspiring. I want to say also, I'm really grateful for all the work you did to try to analyze all the dynamics behind all this. So I want to kind of follow up on your last points of, okay, what do we do now? And so that's why maybe I want to go back to Eileen. And you have been working, supporting, listening, advising whistleblowers for 2 decades now, which is crazy because I cannot imagine, it's hard to make people understand what's the emotional toll of that work. And I really admire you for that. I'm curious, I want you to explain, what do you do to help the whistleblowers that's called the helpline? What do you tell them? What's your advice?
First, Erika, your story is amazing, and I think that I wouldn't have been able to do that at a young age, because a lot of whistleblowers in their early 20s are don't have the life experience to cope with that. So I think you're amazing. There's no one size fits all. Each case is different. The one common thing that happens is when whistleblowers come through to us and they start to talk to us, they suddenly start to cry because they say, you're the only person that gets it, and I've rung loads of people for help, and you get it, you understand. And I think it is that thing that you're swimming against the tide, and it's frightening. It's like you're the first person that's got to stand up and say that's wrong, because you're waiting for someone else to put their hand up and it doesn't happen. And it's a very lonely place to be. And often as not, some whistleblowers, I was lucky. I had a brilliant husband, and the regulator that we went to upheld all the allegations, but they told him to tone it down. So he had to become a whistleblower himself. So we were, that's the level of thing that you're fighting, the barriers that are there. Because nobody wants to really address the problems, what's wrong. And I think for whistleblowers, it's not a deliberate choice. It's something they just have to do, because to do something else, you couldn't live with it. You can't live with it. And I think that's a common trend across all sectors. And, we deal with whistleblowers from all sectors. I think care staff and staff that are on, they're on minimum wage. And a lot of these staff can't get help from anywhere. They've got no reserves. They have to choose between maybe paying their rent and feeding their family or blowing the whistle. And that is not a choice that people should be forced to make. It is not. And I think if we have a justice system where hopefully we don't send too many innocent people to prison, but if we have a justice system where we can't defend those who do the right thing, never mind the wrong thing, but if we can't defend those who do the right thing, then I think shame on the UK law, shame on any law that fails to protect people. And that's why we campaign for Edna's Law, because Edna's Law is written by whistleblowers. It's the only law in the world that has been written by whistleblowers. So what we do is we listen to people's stories. Some people need help, as in getting a reference to get another job, so we help them with that. Some people need to retrain because they don't want to go back to work in care sector or whatever sector they're from. So, we help them to try and get into a university course. That's quite a common thing, to retrain somewhere else. It's just listening and knowing that they can contact us at any time and that we are there to help them. And the majority of those who we've helped go on to help other people. And so we have no paid staff. We run on the sheer goodwill of people who we've helped who want to pass that on to someone else by helping them. So we have people in different areas of the country who might go to disciplinary hearings with people, who might go to tribunal, make notes and sit with people and hold their hand and support them. It can be a whole raft of different things. I think the big thing, if we had to say in one word, we empower. We try to empower whistleblowers. We try to help them get the skills they need to move on with their life. We try to help them with the practical things in the short term, whatever they need. And the majority of whistleblowers don't really want to go to court, but we have to have a law that protects them. The majority of whistleblowers want the wrongdoing stopped because they cared enough to report it, and that's what they want acted on. And they don't want it acted on in a few years' time when there's a big investigation into the original investigation. They want something done now, and that doesn't happen. And I think that is the shame of it. But I think, in a nutshell, that's as best I can answer that, really.
Thank you, Eileen. Sorry, I have one follow-up question with a little bit of a conflict of interest, but I heard you talking at the CIJ symposium, and you were saying that if you would have done one thing different in your case, is that you would have called Panorama, so the press, to make stop the abuse. So I wonder, and it stuck with me, of course, because I do focus on the whistleblowers who go to the press. And so I'm interested in, why do you think, if the whistleblowers want the abuse to stop, you think going to the press is one of the best solution? And I'm sure it's not the solution all the time. But can you explain to that? Because there's,
Yeah, often it's not that people will go through everything. They'll go to the regulator, they'll go to safeguarding, they'll go to the police, they'll go back again, and they'll pester. One good example, one of our trustees, Caris, she was a cleaner in a care home. She's now training to be a lawyer. She was seeing people left without food, etc. And she went to safeguarding, she went to police, she went everywhere. And there was 14 of the staff doing this, and nobody would do anything. So we put them in touch with Panorama, and Panorama went in and they filmed in this care home. Obviously, I can't get Panorama into every care home. There's just not enough camera crews to go around. They went in and filmed, and the CQC, the regulator, came in during the filming and rated the home good, whilst this crew was filming abject conditions. 3 people were jailed as a result of that investigation, and they will never work in care again. And I want that on all abuse cases. I want accountability. We want people that are identified as dangerous taken out of the system. We actually want something that authorities can't understand. We want action. But the media are one of the most effective routes, and we work closely with the media because we know it's a last resort for people, and people are frightened going to the media, and we put them in touch with journalists that we know and trust and have known for years. We don't say to people go anywhere. We say just go to whatever journalist, but that is a way of getting the truth out. And unfortunately, in the UK and probably elsewhere, the truth is buried. The truth is buried and no action is taken because we have a system that rings up the care home and says, are you guilty? And the care home says no. And they go, okay, then. And that's it. If the same system was applied, we could empty the prisons overnight because nobody would find themselves guilty. They could just, So at the end of the day, the media is so important, and freedom of the press is something we're very passionate about, and we try to highlight that with the Gavin McFadden Award, which is the only award that whistleblowers vote for a journalist every year. And it's been running for several years now, so that we can try to shine a light on that as an issue. And a new project we've got soon is the Richard Turner Award for Integrity in the Investigation of Abuse, because believe me, abuse investigations are so poor. They are dreadful. So we try to do it by highlighting what's wrong and trying to do something to celebrate the good people that are out there and do their job. So the media are so important.
Well, thank you, Eileen, for all this. That's really inspiring as well. So, Erika, I want to go back to you, and I'm really grateful for the explanation you gave us, trying to destructure the dynamics behind speaking up and all that. And I want to go further, and basically, how do you think we as a society could encourage workers to speak up? Now that you showed us what's the dynamic behind, what can we do?
Yeah, I think a good framing that I've been utilizing recently is kind of splitting it up into parts, right? So there's the first part of like, what can we do as individuals, right? Where does what are the things that we can do better? So one is the act of sort of speaking up and getting more comfortable having hard conversations with people and sort of telling the truth as much as possible when we see some of these behaviors going on. And also to be an ally to those and understand that when people are speaking up, where is that coming from and why is that happening? And instead of seeing these people as adversarial, maybe taking more of an inquisitorial approach, what are the facts that they're presenting us? Why are they presenting them to us? And how can we better build psychological safety for these people that are really doing something that's challenging? It's very, very challenging. It is never fun being the bearer of bad news. It really is not. There are very few cases that it's exciting. And I think on the secondary part, then there's at the organization and the leadership, side of things. Do we have policies within our organizations that protect whistleblowers? And is there clear communication to that for the people who are part of organizations, right? Are they not going to be fired? Are they not going to face retaliation? Do they have protections and controls? Are there things like Eileen provides? Are there whistleblower networks? Do people have someone to turn to that they can trust when they see an issue? And is it clear to them that what is going to be done about it? And these types of, the policies, procedures, processes of really trying to be proactive about implementing those, I think is really crucial at the organizational level. And then there's at the systematic level, right? In the case of COVID, now that we understand that it did take a whistleblower sort of coming forward and saying something, can we reach an international consensus that if there is another case where we have another healthcare crisis, that these people are going to be protected, that they can understand that if they see something and they say something, that they have channels of support. And, supporting, organizations like yours, Delphine, the fact that you guys are essentially trying to be that way, in which people will have a point of contact where they'll have the financial protection, that they'll have outlets to get their voice heard in the event that they're in a particularly oppressive system. So I think, looking at it from the systematic level of what is it that we can advocate for to make it more commonplace for people to speak up, specifically in these high severity cases, is important. And I think also re-examining incentive structures, right? Whistleblowing is so much aligned to sort of financial incentives and what those are. But I think as a society, we really need to, what is our public fiduciary, public duty to one another. We talk about fiduciary duty. We frame things so much in that context. At what point do we really have a strong conversation about what is our public duty to one another? Because if COVID has elicited anything, is that we are a highly interconnected world now, and the actions and behaviors of one place really does affect the whole ecosystem and the whole world. And so how do we come back with stronger ideas about safeguards for people who speak up, and the different duties that we have as just citizens?
Mm-hmm. No, totally. Eileen, I'm sorry if I take that angle with you for the next question, but you have the most history here. And I kind of would like you to bring a little bit of light and tell us that still things improved, or you see some light.
The thing is, there's nothing more frustrating, I suppose, than to have the answer. My book, There Is No Me in Whistleblower, redefines the public interest, and I think that the public interest element has to be at the heart of whistleblowing. So, and loads of mistakes have been made about that. You'd be quite surprised how many people think they're a whistleblower that are not. People whose bunion operation has gone wrong and they want to complain about it. That's a very valid complaint, don't get me wrong, but it's not in the public interest. So I think there needs to be a clearer line about what is whistleblowing, because the more people don't understand it, the more it kind of detracts from the real issues. And so there needs to be education there, and I think there should be education in schools about whistleblowing and the public interest. The second thing is, we don't want to see a two-tier system where people from banks, we want all whistleblowers equally protected under the law, regardless if they're healthcare or from banking or whatever sector. And in many ways we're alone in this, because there are other organisations that think that we should protect banking more effectively, and then everybody else can have a little bit of what's left. But we don't. Whistleblowing it's not about incentivising people. It's about making sure that people have got, awarded for their detriment. So there should be justice, and people should be compensated for the loss of earnings, or if they have to retrain for a different job, which many whistleblowers do. They can't work in the same sector, and they need help with all of those things. So I do think that there needs to be, Edna's law would actually, it's all laid out in the book, but it would make it a criminal offence to fail to act on concerns. Now, it would only take 5 or 6 cases where people were sent to prison for failing to act for things to change. Because believe me, if murder wasn't illegal, guidelines and telling people not to do it wouldn't be so effective. You need to have a law that says this is wrong, and if you do this to your employees, you will pay the penalty for that. Some companies are brilliant, but for example, I know for a fact of at least 80 care companies with major problems in their culture, and at the end of the day, there isn't a policy that that would touch those people, because they are in many ways, people at the top of these organizations and the systems that we have, like regulators, are in many ways immoral people. That's why they're at the top. That's why they're running these organizations. And I think it does come from the top down. I think that we need to start seeing whistleblowers being heard and influencing law and influencing policy. And that is something that's not happening. So it should be empowerment.
Mm-hmm. Erika, I want to go to you to try to give us some light here. And I want you to tell us about your work at Ethics in Entrepreneurship and how you're trying to move the lines, working with founders, workers, investors. Can you tell us a little bit more of what you are exactly doing to try to create a culture of honesty and ethics? And how, is it working?
Yeah, I think basically, so it, you know, there are so many different forms in which you, I think what big gap that I had noticed is one coming from one of the largest ethical collapses that you could possibly imagine, which sometimes there are these sort of oddball cases that you can't control for. Like fraud is unfortunately probably always going to be with us. It's just sort of one of these kind of incidents that happens every once in a while. But I think the Theranos case really highlighted to me the similarities and the types of instances where corporate culture definitely will propagate a lot of ethical lapses and unethical behavior. So how do we go within startups, give them the tools to embed ethical questioning into their organizations from the point at which they start their companies and the things that they decide to launch, to the steps in how they structure their organization? You know, what are those cultural controls? How do you get people to actually make decisions based on their values? And how do we understand and get to a point where you have values that are no longer just oriented towards self-interest, but also towards sort of like a self-transcendence of how we interact with other stakeholders outside of our shareholders, and then the sort of systems to support that. So a lot of what we're doing is trying to figure out what is that baseline education and how can we experiment to sort of propagate new types of organizations that are able to basically transition from this model of maximizing shareholder value at all costs to stakeholder value, and what does that look like? And we've stuck with startups because that's just what I'm more familiar with, having worked in the technology sector, and also I think a lot of the new companies that you're going to start seeing are going to be digital companies that are inherently scalable, they're borderless, and they're high growth. So at that point, how do you make sure that there are good systems of checks and balances for private companies that scale really fast, are borderless, and have very little to no oversight? So that's what we're doing. The educational resources for that, going in and helping sort of figure out, you know, what does this new type of organization look like as we sort of transition out of this older model of maximizing shareholder value that just doesn't seem to be sustainable on so many different fronts.
And do you feel that investors, VC, respond to that and want to include that in the future they want?
Some, not all, right? I think it is very easy to say, you know, my bottom line is to maximize, profit at all costs. And there's not only, there are good and bad reasons for that, right? It's very clarifying. If you say like, my only goal is to increase as much money as I possibly need to, like that's very, in the business world, it's kind of a good thing. It really narrows your sort of scope on what you're trying to do. You do start to see people in even the top, like Fortune 500 companies came together and sort of made a public statement that there has to be this transition away from maximizing shareholder value at all costs to stakeholder value. But in terms of seeing that in very clear metrics and action steps, and sort of systemic change, it's kind of pending, right? We're seeing where that goes. So you have some reception. You have some people who are like, you know, this is too complicated. This is just not the way things work. But yeah, I think we'll
actually,
see.
to go back to some point that we heard from you and Eileen, going back to the empower the workers, empower the whistleblowers, and I think that it will be a combination of factors that will really help change the whole thing. But I do believe that empowering the workers, empowering the future whistleblowers, and also kind of use this responsibility diffusion factor. So also make that it's not one whistleblower, but maybe a group of whistleblowers to kind of create a collective of voices. And I think we see that more and more in some tech companies, and we see that it changed. So down to the top,
you are seeing a lot of mobilization at that worker level, right? And even in terms of external organizations that are trying to hold organizations accountable and hold people accountable, there are sort of mechanisms in place, whether that's building better pipelines to the media, so these cases can actually come to the forefront of the sort of public awareness, whether that's in terms of actual things like what Eileen is doing, right? Are there sort of reporting lines that people can turn to and then go and engage with regulators? I think there's been a sort of proliferation of lots of law firms that are willing to work on contingency to help navigate the sort of messy landscape of what are the different types of lawsuits that you can file in order to institute organizational change and hold certain organizations accountable. So you are seeing a lot of interesting kind of developments to help support workers and these different initiatives.
And I think it's encouraging. It's not easy, but I try to stay optimistic. But then, Erika, you brought us back to one point Eileen mentioned earlier, which is that in some case, whistleblowers got trapped in some legal endless labyrinth. And Eileen, you used the word kind of exploded. Can you explain what you mean by that and how to avoid this potential legal trap?
Well, I just think it's about having a very effective law that's based in reality and that also puts the victim of silence at the heart, because often as not, that's who's forgotten. It's the person. That's why Edna's Law is dedicated to Edna. She was abused as a child and nobody spoke up for her. She had no family. She was put in a care home and she was abused in her last days of her life. The law is dedicated to her because we want to put the victims of silence at the heart of the law to protect whistleblowers, because the whistleblower is only their representative. There were 7 of us and 20 further witnesses, but it wasn't enough. It wasn't enough for action to be taken, and that's typical. It's typical of what happens. So there has to be an effective deterrent there, and it has to be, it's not only that you stop the abuse in one place, because what happens is companies that get away with that they go on, and hundreds of other care homes were involved with the same company across the world, actually. We recently gave evidence to the Australian Royal Commission on the same company. So 20 years later, you're still trying to stop the abuse just in the one company. The fact is, I suppose, if you take the worst case scenario, and there's quite a lot of worst case scenarios, believe me, and then try to come at it from that aspect, if it doesn't fix these people, but there's lots of good guys over here and they've got policies and they'll be fine. But if we can't have a law that actually looks at the worst end of the scale and takes that into consideration, nothing will change. And I think that's why Edna's Law, given a clear timeline, a clear place, a clear email that you contact with your concerns. For example, with the Zeebrugge ferry, they would have had 1 hour to stop all ferries sailing under Edna's Law. That's how clear cut it is. There is no please be nice and don't be horrible to whistleblowers. We'll give you a smacked wrist. There is a clear deadline. And if you breach that deadline, you go to jail, and you go to jail straight away. And, I think there has to be tough action, because we're hearing thousands and thousands of cases across the world, again and again, the same issues. And, the UK whistleblowing law, they brought it into an employment setting. We were the first people to use it. The verdict in our case said, people have been dragged down the corridor by the hair and been killed with antipsychotic drugs and been slapped and kicked, and the whistleblowers actually physically assaulted as well, hit with chairs. They said we should have considered the consequences to ourselves before we spoke out. And that, it sums up the UK law. It's whistleblower hostile. The employment tribunals only want to deal with your contract. They don't want to deal with the disclosures, and nobody else is going to deal with them. So you end up in this situation where you're told you shouldn't have said anything. So it's your own fault. And we've seen this happen to so many.
Try to keep the light. Is the new EU directive that will bring a new kind of level of protection to whistleblowers would help the UK, you think, to improve its legislation to protect whistleblowers?
The EU one is fatally flawed, I'm afraid. On one thing, it relies on it relies on prescribed regulators. If you rely on a prescribed regulator, you're in big trouble straight away, because the regulators that we have gone from bad to worse across all sectors. And we have thousands, and we're at 16,000 people telling us they went to their regulator and their regulator failed to act. That's a hell of a lot of people. So we want to understand that. We put out a call for evidence, and thousands of cases are coming in. Aviation, education. All of these people are telling us the same thing. So we've extended the deadline on that. So all regulators are looked at, and we want to look at the whole picture and see why. We're spending billions on regulators, but we won't spend a few million on a proper whistleblowing law like Edna's law. I don't think really the government is that.
So better whistleblower protection will definitely include and need to include an improvement of accountability of the regulators. Well, I think we unpacked a lot of things here. I think it's time to turn to the audience, and look forward to move to the Q&A section. So Tatiana, what are the questions for our panelists?
Contributions also from my side. We have some question from the audience that is following us on the chat. So I first would like to read one question for each. There was one question for Eileen. Somebody wants to know a bit more about the campaign for Edna's law, and also how it could help whistleblowers in the future. You said already a bit, but people would like to know a bit more how this could help concretely whistleblowers. And then another interesting question for Erika. Seems to me that a lot of the issues with whistleblowing come down to the culture of companies and businesses. What advice does ethics entrepreneurship offer on improving honesty? So I would first pass it to Eileen and then Erika.
There is a petition for Edna's law on change.org, which has a lot of information on there. It's the only proposed law in the country at the moment that has so much support. There's nothing to touch it, because it's been signed by whistleblowers and people that have lost their loved one because a whistleblower was silenced. So there's lots of information on there. The full detail on Edna's law is in the book There Is No Me in Whistleblower, which is free to whistleblowers. If they need a copy, please contact us. Everyone else, I'm sorry, but you'll have to pay. And that has all of the detail in it. And I think what it does is it clearly defines what whistleblowing is. And that is where there's major problems at the moment. We've got court cases where everyone's been protected except the whistleblowers. And so, that's how poorly written the law is. It was never written to go into a courtroom. It was reliant on policies and procedures. And unfortunately, the people that wrote it also take all their income from selling policies and procedures, conflict of interest. And I think that whistleblowers need to write the influence law. And Edna's law is based on 9,246 cases. And we'll, if we have to get 1 million, then we'll get 1 million. But whatever it takes, we won't stop fighting, because we know that this law will change things. It clearly lays out that failing to act on a whistleblower's concern is a public interest crime, and it goes to the police. The whistleblower hasn't got to go running around lawyers. Sometimes whistleblowers have to approach 30 lawyers. They don't really want to take whistleblowing cases. They're very time consuming, and they're very the hard work, and currently there's no prospect of winning. Most whistleblowers can't access the law. One of the cases we had was somebody who was registered blind, self-representing in a tribunal with no help, and that's the reality for most whistleblowers. They have to go up against big companies with QCs, and they're on their own with no lawyer. That is not justice. That is a charade. So Edna's law lays out clear requirements for each kind of issue. The employer has to follow that guidance. There's a paper trail. The whistleblower reported their concerns. Currently, we have this situation where employers go, "Oh, they never told me." That's one of the biggest defences that's so effective in the courtroom. So Edna's law would make it a criminal offence to fail to act on concerns. The case for the whistleblower's detriment is brought by the state, and the whistleblower their lawyer is supplied by the state, because the state has to take responsibility here. And people are acting in the public interest. Surely it naturally follows that the state have to take that case for the whistleblower. So in a nutshell, that's how Edna's law would work. It would actually make it a criminal offence. But obviously that's a very short summary. The Public Interest Crimes Unit we'll be on a specialist unit that deals with those kind of crimes. So action is actually taken to safeguard people like Edna, who don't have to wait years for a case to be investigated, because 9 out of 10 times it's not investigated properly and nothing is ever done. Is that?
Thank you.
Thank you.
Yeah. I just want to add one thing, because you were mentioning a book that came out. I think this could be useful to tell our audience. Could you tell just the title and where the people can find it, and then we can pass it to Erika?
Yep. The book is called There Is No Me in Whistleblower, and it's called that because people say that's a strange title, but there is no me in Whistleblower. Whistleblowing is about you and yours. It's not about me and mine. It's about the public interest. And I want to bring whistleblowing back to that, because it's been lost in all of the debate. It's often lost that the actual people that suffer, the public, that's lost. So it's available on Amazon. It's called There Is No Me in Whistleblower. And I use the case of Patricia Douglas, who was 17 years old and was attacked and raped in Hollywood. And the first word she uttered when she went to the police was, "I don't want this to happen to someone else, so I'm reporting it." And that's how I define the public interest. Because even if something has happened to an individual, they go beyond themselves to stop it happening to someone else because it happened to them. And so you have to read the whole book to understand where we're going, but we have a scrutiny. Edna's law has an inbuilt scrutiny system. So when the police investigate, there has to be scrutiny of what decision they reached.
Thank you.
Is that okay?
So then I repeat. Thank you. Yes, I repeat the question for Erika. So it's about the issues of culture around whistleblowing, and also companies and business that are related to whistleblowing cases. So which advice do you give with ethics in entrepreneurship on improving honestly?
Yeah, I think it is exactly that. Like, the culture really drives a lot of the effectiveness of the various initiatives that are run in the context of, say, a corporation or any type of organization, really. And I think when you're starting to sort of talk about how do you build effective culture of honesty, of dissent, of, you know, being able to speak up when either you see something wrong or even in the context of seeing something done right. Getting that buy-in from the leadership is, you know, having leaders stand up and say that this is important to me. It's important to me that we have the case that people feel safe enough to say the truth and know that they're not going to face retaliation, that there is going to be the case that we have procedures and processes in place to handle your complaints, and that ideally there's a level of transparency to the ways in which they're run, not in some sort of smoky back door of, you know, the kind of like executives room. And also, you know, when that message is sent from the top down to the rest of the organization tends to also align with that, where you're not going to have these retaliatory tactics where people who are maybe in middle level management that are scared to allow people to speak up because there's a recognition that, hey, this is the culture of our organization. We like healthy dissent. We're going to make people feel safe when they have a concern. And so getting that leadership buy-in for that is really important, making sure that runs through the different levels of management and operators is very important. And I think once you have that cultural consensus and you have a certain level of transparency around that, it gets easier to create the proper systems and the proper trainings or the proper, you know, policies in order to support that for people's specific organization. I think another thing that we're seeing in tech and maybe other different types of industries is you can't always do everything internally with an organization to institute change. So I think something that I've been really excited about is seeing the cultural shifts around everyday citizens to say, you know, we are going to build these social movements to say, essentially, this type of behavior that you have engaged in is no longer acceptable, and we want to see changes. And this is the way that we are going to ask and demand for change. And I think this has been something that's been really, really effective, right? We had in Hollywood, for example, I'm in Los Angeles, of rampant sexual harassment and sexual assault that was just accepted as part of the culture of being in the entertainment business. And people rose up and they said, enough is enough. I'm not going to be treated this way. We're not going to let predatorial people continue to act against, you know, people who are victims of these sort of heinous crimes. And I think that's also something that's very exciting about our generation in particular, the fact that, you know, it's easier to communicate with people through the internet. It's easier to have transparency and documentation of what's going on behind closed doors. There's easier outreach to lawyers and regulators in different systems. So I'm also very interested in what's happening sort of external to the organizations as well. And there have been many social movements that have popped up, whether that's in sustainability, Future for Fridays that you guys have in Europe, whether that's been in Me Too in terms of recorrecting like egregious sexual assault and harassment that was happening in the workplace, and even for freedoms, freedoms in media and press and in just political freedoms that are happening all around the world. I think that's a very interesting place to pay attention to as well.
Thank you, Erika. Then there is a question that I think could work for all of you, including you, Delphine, because I think it's something that actually works really well with the work that each of you is doing. And this person is asking, there seems to be a sliding scale from slight incompetence and conflict avoidance up to heavy abuse. How much can we change by trying to create better conflict culture, speaking out in our everyday context?
Erika, you want to go first?
Oh, that's a good question. Yeah, I think one of the things that I promote right now, we're in a global pandemic. Life has gone completely in a different direction than anyone would have ever expected. Emotions are high. There's lots of tragedy. I think in terms of resolving conflict, the number one thing that we can all sort of operate by is a certain level of kindness and compassion, and a higher emphasis on just providing psychological safety for ourselves and then for other people, because there are lots of things out of people's control. There are lots of forces that are being changed and moved in different directions. And I think it's easy to become defensive and adversarial against one another. But I'm hoping that another outcome out of this crisis that's affected everyone is that we also get stronger ties of unification, of understanding in our everyday lives. Help people in your local community, call your grandmother and make sure she's okay and that she can talk to you about her favorite TV show. These small actions of just being there for one another and understanding that everyone is kind of in a terrible, not where they want to be. Let's just say that. They're probably not where they anticipated or wanted to be. I think this is something on a day-to-day basis that can help us build a little more resiliency against this kind of challenging time, and hopefully build better connections between each of us.
Eileen?
Yes, there is a sliding scale from the diabolical to the ignorant, maybe, when it comes to targeting whistleblowers. I think at the end of the day that we have to have something that encompasses everything, so that, the worst abuses, etc., are dealt with. Being a whistleblower is a very lonely place to be, and it's like you're swimming against the tide. And a lot of people have said the thing when they've whistleblown, and I can identify with that, is the actual feeling of feeling sick, because they know they've seen, now we're seeing a situation where they know the law doesn't protect whistleblowers because it's got so common. Everybody knows that. And secondly, they know what will happen to you if you say anything. And that is a legacy. That is a legacy that we're seeing that has cost thousands of lives and allowed so much suffering. And that is a legacy of the law's failures and the law's reliance on just saying policies will fix everything. They won't. Some people cannot be brought to book with policies. They're just beyond that. And I think we need to start looking at the types of people we're putting in charge of regulators and in charge of big companies, because there's a lack of morals there, for sure.
Thank you. If I might just end in one sentence, and what I will remember from our conversation is, I think the light is in empowering workers, empowering individuals, and that we should be encouraged by the impact of social movement when individuals are empowered and when they come together. And that's individuals and social movements that we are seeing today are pushing the governments, the legislators, the regulators to do better and to protect us and to protect whistleblowers. We're not there yet, but I see every day the impact of social movement and media pushing companies and government to do better. So let's go, continue the fight, ladies. And thank you all for all you're doing and for this conversation.
Yeah.
Tatiana, thank you for having us here.
Yeah, thank you guys so much.
Thank you so much. Thank you. This was really an important conversation. I hope you will also follow us in the next days, because we are going on with our discussion, also discussing about whistleblowing and people that are trying to speak out during the pandemic. So thank you, Erika, Eileen, and Delphine. I just want briefly to introduce what is happening tomorrow, and also to remember everyone that it's possible to watch until Sunday the film Coronation of Ai Weiwei if you are in Germany. So just go on our website and register to watch the film, and you can freely watch it from Germany until Sunday. Tomorrow we will start at 3 with the panel Digging Deeper into Healthcare, the vaccine rollout, pandemic journalism and corruption. We will have with us Sarah Steingruber, Serena Tinari, and Alexander Nanau. The panel is moderated by Jonathan Cushing of Transparency International. Then at 6:30, speaking about Berlin time, we have a second panel that is called Voices of Care, Exposing Dangers to Public Health. And we will have Delphine again with us that will tell about her own investigation and the work they did with the plasma files. Then Yvonne Delmark and Helen O'Connor, and the panel is moderated by Cassie Thornston. And finally, our last day is Saturday. We start in the morning with a panel between 11 and 1. The panel is called Julian Assange, Repression, Isolation, and Lockdown. And we will have another great, an important group of women speaking about the persecution of the moment of Julian Assange. So we invited Soulette Dreyfus, Jennifer Robinson, Stefania Maurizi, Felicity Ruby, and the panel is moderated by Anna Myers. Also, I want to remind all of you that as part of our community program, we also have workshops, and it's still possible to subscribe to the workshops. And especially, I want to suggest you the workshop on Saturday afternoon with Serena Tinari that will also speak tomorrow. And the title is Get Your Numbers Straight, Making Sense of Health Data During the Pandemic. So thank you very much, and thank you so much also the team of the Disruption Network Club, all the production, Elena Velianowska, Nada Baker, Jonas Franchi, the great streaming team of Boiling Head Media, and also Alana Travers that have been working hardly with our chat, answering to a lot of questions and sending also a lot of comments to our public that was following online. So thank you very much, all of you. And tomorrow we will come back with our program. And thank you for this very important panel, the very important work you do. I'm very happy and proud and honored that you were with us at the Disruption Network Club. Thank you.
Thank you. Bye-bye.
Thank you.
Thanks. Bye.